A lot of the numbers are coming from this testing surge we've seen in Victoria. Another pop-up testing clinic here at the Melbourne Aquatic Centre right next to Albert Lake. If you take a look behind me, it is extremely busy at the moment. There are dozens of cars snaking their way out of the car park. Quite a lengthy wait for the people here. We know Victoria is completing in excess of 20,000 tests a day, 10,000 tests a day in each of those 10 hotspot areas. That's the aim at the moment. And to help bolster the capacity, we know that 800 support staff from the Commonwealth have been flown to Melbourne to assist with the carrying out of those tests. That's in addition to the 250 or so ADF personnel who are not only helping to conduct the test, but also flying those samples interstate to New South Wales, to South Australia, to Tasmania and Queensland to bolster Victoria's testing capacity. Of course, we saw 75 new cases of coronavirus in Victoria again today, expecting another bad day again today, but not expecting those numbers until early to mid-afternoon, and that's because of the sheer number of tests and data that these contact tracers have to go through to establish the newest case numbers. Now, 10 hotspot suburbs have been identified. The state government here under increasing pressure to lock those suburbs down, similar to the restrictions that were in place right at the start of the pandemic. That pressure now coming from the federal government, although it does present its own problems. We have heard that locking down suburbs in a metropolitan city like Melbourne is much more difficult than it was in Tasmania.
To lock down an entire town, as happened with Burnie, is very different to attempting to lock down individual suburbs in a very large metropolis of nearly 6 million people like Melbourne. So it is a different situation, and it would be much more difficult just to lock down individual areas.
Borders are another big topic today. Of course, we've just heard South Australia has revised its plan to open the Victorian borders on the 20th of July. Similar announcements perhaps from Queensland later on today. New South Wales, there's no restrictions in place just yet, although the Premier has says people should be refusing access to their homes if people are coming from these Melbourne hotspots.
You are the boss of who comes into your home. Do not allow anyone from a hotspot in Melbourne or from Greater Melbourne to come into your home. You have the right to say no. Please, if you're a loved one, a friend or a family member, please don't come up at this time until the community transmission is under control.
Now, help is coming to Victoria from all around the nation. We've just heard that Western Australia's former Chief Health Officer is flying to Melbourne to assist with Victoria's pandemic response. He'll help to relieve Chief Health Officer Brett Sutton as well as Deputy Chief Health Officer Annalise Van Diemen, who have been working tirelessly for weeks. So he will be assisting them in a relief point of view, not replacing them for the response to the pandemic.